When you're trying to figure out something important like, uh, like cancer screening, it can feel like you're lost in a forest or something.
Totally get that.
Yeah.
That's a lot to take in, especially for, older adults in Canada.
Well, that's why we're here today, to really dive deep into this guide from the National Initiative for Care of the Elderly.
Absolutely. We'll break down those recommendations and all that. But more importantly, we want to make sure you understand what they really mean. Right?
Exactly. Like, what are the real risks and benefits, and how can you talk to your doctor about making the best choices for you?
That's the key.
Because let's face it, 90% of cancer cases in Canada are diagnosed in people over 50. That's a huge number, right?
It is. And lung cancer is actually the leading cause of cancer-related deaths in Canada for both men and women.
Wow, that's really scary. It sounds like early detection is super important.
It really is. And that's exactly why screening is so crucial. The idea is to catch these cancers before you even have symptoms.
I see, that makes sense. So let's start talking about some specific types of cancer. Prostate cancer is a big one for men, right?
Yeah, definitely. And as men get older, the risk goes up. But there's no one perfect screening test.
Right, and that's where it gets kind of complicated.
Yeah, a bit. We have the PSA test, which looks at a protein in your blood, but sometimes it can show a problem even if there isn't one.
Oh, so that can lead to unnecessary procedures.
Exactly. And then there's the digital rectal exam, which most people aren't exactly lining up for.
I think I'll pass on that one. But seriously, what's up with the Canadian Task Force on Preventive Health Care saying they have a weak recommendation for the PSI test for men between 55 and 69? What does that even mean?
Well, basically, they're saying the evidence isn't super clear-cut.
Okay.
It really depends. For some men, early detection with the PSA test might be worth the risk of maybe getting some false positives or extra procedures.
And for others, it might not.
Right. It comes down to individual factors, which is why talking to your doctor is so important. They can help you figure out the pros and cons.
Makes sense.
And for men over 70, the task force generally doesn't recommend routine PSA testing at all.
Okay, so what about colon cancer? That one affects both men and women, right?
It does. It actually develops from polyps in the lining of the colon. Those polyps can sometimes become cancerous over time.
Oh, wow.
But the good news is if it's caught early, colon cancer is usually very treatable, and we have a bunch of different ways to screen for it.
Oh, it's good to hear.
Some are easier than others. There are those at-home tests that check your stool for blood, which could mean you have polyps or cancer.
Those sound pretty straightforward.
Yep. Then we have flexible sigmoidoscopy and colonoscopy.
Oh, yeah, I've heard of those.
Both use a tiny camera to look inside your colon. For average risk adults, aged 50 to 74, they say you can do either the stool test every 2 years or a sigmoidoscopy every 10.
Got it. And what about for older adults?
They generally don't recommend routine screening for those 75 or older unless there are other risk factors, but they do really emphasize colonoscopy for high-risk individuals no matter how old they are.
That's important to know.
For sure. Talk to your doctor about it.
Okay, we've covered prostate and colon cancer. Let's move on to cervical cancer, which I think is almost always caused by HPV.
You're right. And catching it early is so crucial because cervical cancer is very treatable in the early stages.
Yeah.
We have a pap test for that. It checks for any abnormal cells in the cervix.
So what about the HPV vaccine? I know they have that. Is it recommended for older adults in Canada?
Not really. It's usually recommended for people up to 45.
Got it. So back to screening, what does the task force recommend for cervical cancer?
They recommend pap tests every 3 years for women aged 25 to 69 who are or have been sexually active.
Okay, so you need regular screenings, but they can stop eventually.
Yeah, if a woman has had 3 negative pap tests in a row in the past 10 years, after age 69, she can stop getting screened.
Okay.
It shows that cancer screening really isn't one size fits all.
Yeah, for sure. Now, we talked about lung cancer being the leading cause of death, and we usually think of that as being caused by smoking.
Yeah, smoking is a huge risk factor.
Yeah.
But it's really important to remember that even non-smokers can get lung cancer too.
Oh, wow. So even if you've never smoked, should you still be thinking about lung cancer?
You should definitely talk to your doctor about any unusual symptoms. But when it comes to screening, the Canadian Task Force has very specific recommendations. They recommend a low-dose CT scan every year for adults between 55 and 74 who have a long history of smoking.
So it's really for people who've smoked a lot for a long time.
Exactly. And they only recommend screening for up to 3 years in a row.
Okay, so let's talk about breast cancer. That's a big one for women, right?
It is. About 1 in 8 women in Canada will develop breast cancer in their lifetime.
Wow, and the risk goes up as you age.
Definitely. The main way to screen for breast cancer is with a mammogram.
Right, a mammogram.
It's basically a low-dose X-ray of the breast. It can pick up signs of cancer even before you can feel a lump.
That's pretty amazing. So what does the task force recommend for mammograms?
They don't actually recommend routine mammograms for women between 40 and 49 unless they have a family history or other risk factors.
Okay,
For women aged 50 to 74, they recommend a mammogram every 2 to 3 years.
interesting. So 50 is the recommended age to start getting mammograms regularly.
Yeah, that might surprise some people.
Well, it does.
Research changes, and so do the recommendations.
That makes sense. We've definitely covered a lot today. The different types of cancer in older adults, the screening methods, and the Canadian Task Force recommendations.
There's a lot of info.
It is, and it's
Right.
important to remember that these are just guidelines.
Exactly. Every person is different, and the best approach to screening has to be personalized.
Which means talking openly with your doctor is super important. They can help you make sense of all this information
They can.
and figure out the best plan for your health.
Absolutely.
It really is like having your own roadmap for your health.
Yeah, and it gives you the knowledge to really be involved in those conversations with your doctor.
Exactly. And speaking of taking charge, I feel like there's this whole other side to the cancer conversation that we sometimes forget about: lifestyle choices.
Right. It's not just about screenings. There are things we can do every day to potentially lower our risk.
Okay, so beyond the screenings, what can we actually do to lower our risk of cancer?
Well, there are definitely things we can't control, like getting older and genetics and stuff.
Right.
But lifestyle choices make a big difference.
I'm guessing you're going to say something about smoking.
Well, yeah, smoking is a major risk factor for so many cancers, like lung cancer, which we said is the deadliest. Quitting smoking, or even better, never starting, is one of the best things you can do for your health.
True. What about other things besides smoking?
Diet and exercise are super important. Eating lots of fruits and veggies and whole grains and being physically active can really lower your risk.
So the classic advice is actually good advice.
It is. It's not just about looking good. It's about reducing your risk of cancer and just living a healthier life. And we can't forget about sun exposure.
Ah, yes. The sunshine vitamin. We need it, but too much isn't good.
Exactly. Too much sun, especially without protection, increases your risk of skin cancer. You got to protect your skin with sunscreen hats and clothing, especially when the sun's strongest.
Being sun smart is key. So it's all about balance. We've talked a lot about the practical stuff, screening and lifestyle choices, but cancer is also a really emotional topic. It can be scary and overwhelming.
Absolutely. It's really important to remember that you're not alone. There are so many resources out there to support you. Organizations like the Canadian Cancer Society have tons of information and programs.
And don't forget about talking to your doctor, friends, and family. Having that support system is huge.
It's so important. And remember, knowledge is power. The more you understand about cancer, the better you'll be able to make those informed decisions. Don't be afraid to ask questions. Your doctor is there to help you.
Speaking of the journey, we've talked about screening and lifestyle and the emotional stuff. But something else we haven't touched on yet is that cancer research and treatments are constantly changing. What does that mean for older adults who are facing these decisions?
That's a great point. It means there's always hope. Even if you've been diagnosed with cancer, there might be new treatments that weren't around a few years ago. Staying up to date on the latest research and talking to your doctor about all the options is crucial.
And I imagine clinical trials are part of that, right?
For sure. Clinical trials are how we test new treatments and therapies. They give patients a chance to try cutting-edge care while also helping advance science. If you want to learn more about clinical trials, your doctor can give you more info.
So it's about being proactive, staying informed, and knowing there's always hope on the horizon.
That's a great message. And I think it leads perfectly into our final thought-provoking question for today.
Yeah.
We've talked about so much, screening and the things we can do every day to lower our risk, and even how it all makes us feel.
Yeah, we covered a lot.
It's a lot to think about. It is. So think about what really stood out to you today. As you think about your own health, what questions are you going to ask your doctor?
This deep dive is just the beginning.
Yeah.
It's about giving you the tools to have those conversations, to really speak up for yourself.
That's right. Knowledge is power, and when you understand your options and know what to ask, that's how you can navigate the whole healthcare system.
Exactly. And even beyond the specific cancers we talked about today, the message is the same. Early detection, making smart choices, and talking openly with your healthcare team. That's what really matters.
Absolutely. So as you go forward, remember what we talked about today? Be curious, stay informed, and most importantly, stay proactive. You deserve to be healthy.
I totally agree. This has been a really interesting deep dive. Thanks for joining us.